herpes virus therapy in this illness?
Thank you, Tony. So this is one piece, one angle, and I think the key to one of the things in this meeting, thank you, Joe and Vicky again, is that can we arrive to a greater understanding of this disease, of this process that is bigger than the sum of the individual pieces that each group brings here. So this is just one angle. See, I forgot how to move this. Oh. Here, thank you. So we have this coming from various angles. That there is inflammation there. We talk a lot about that, and so the point today is we have at Stanford the experience that we have had patients who have had extremely highly functional normal lives, and that's the story of many of them, and then out of the blue go like this. And in our experience, we have a growing number that is relatively significant of patients that with antiviral therapy, they get back to here where they were before. So we have seen this shift. They go from normal life, really bad for years, and then with anti-herpes therapy, they go back to normal function. And this is Mia Anderson, who has publicly reported that she has the illness. She's now recovered. On the right side is when she did the internship in our place after the therapy and recovering. So can infection or reactivation of latent infection have a role in exacerbations, in the persistence, or the severity? What is the role that these things can have in this process? Can then more specifically latent infection be associated with ME/CFS severity? Lily Xu in our group published this report where she found that infectious illness, about 35% of the cases, contribute to exacerbations. So the course of the illness gets worsened with intercurrent infection. So the same idea that a really bad infection somehow triggers or is associated, let's say that, with the onset of ME/CFS, it is also known that having ME/CFS, when there is a new infection process, it worsens significantly the illness. And notice that there are other things that could have been infections in addition to that, like international travel, for example, in 5% of the patients, or domestic travel. So usually travel is not infrequent that ones get exposed to an infectious process. The other key thing is that the pathogen not always announces its presence with symptoms. So our immune system can interact with things that normally will make people very sick. And even they are present, they are not causing symptoms, but they may be still engaging an inflammatory dialogue with the immune system. So these are the 8 herpes viruses that are known to infect humans. You can see the first 3 primarily target the skin, but they hide the ganglia, all of them. And then herpes 4 and 8, they are the oncogenic viruses, and 5, 6, 7, they tend to cause more of the like CMV-like manifestations, syndromes, and then they also play a prominent role in immunocompromised patients. And one of the aspects is that those herpes viruses always stay with the life of the host. So once a human being gets a herpes infection, it stays there for life. Tulia Lieb from our group presented on Wednesday how we found this association that the proportion of positive herpes IgG, or the proportion of patients who are infected with herpes, is statistically significantly higher in the severe group. So the more severe ME/CFS, the higher is the proportion of patients who have herpes infection. You can see that for CMV, for herpes simplex 1 and 2. So that's a manuscript that is under review now. So is there a clinical basis for this? So do we have symptoms that suggest that reactivation of herpes could be doing it? And patients often complain of a flu-like symptoms, viral-like symptoms. There are some patients that say that they experience the ME/CFS as a viral illness that never goes away, the flu that never goes away. Or others tell us that they experience this periodically, that it comes every few weeks or every few months. They have these viral-like symptoms that are totally unexplained. This is not like being in the flu season and experience the flu. This is different. This is like something out of the blue, let's say that comes with certain periodicity. Also, a group of patients who are aware that they are infected with herpes simplex, either oral or genital, or shingles, they will say clearly that once they experience the obvious outbreak with the skin lesions, that their ME/CFS gets worse. The other fascinating thing, and for this disease, all you have to do, at least to get closer to it, is just listen to the patients. They will tell you that they have what is called prodromal symptoms, that it can be like numbness or tingling or some kind of like a nerve pain. And even that doesn't end in having the lesions. When they experience that prodromal symptomatology, their ME/CFS gets worse. The other fascinating thing is talking about Dr. Navio's book 1 in Medicine, that we want to translate to book 2 Medicine, is that there is a well-known syndrome that only experienced clinicians can see, and it's called zoster-Sine herpes. So the patients will have the varicella zoster virus reactivated from the ganglia, and it's attempting to go to the dermatomal area of the skin, but it does not reflect in the obvious skin lesions. But they are having the reactivation of the VCV, and then patients with ME/CFS will say that that's where the whole thing of the exacerbation. Even more fascinating, if you take these patients and give them herpes suppressive therapy, few years later, they are much better. And we have had patients with the herpes, the trigeminal roots, like especially 3 on the mandible, and they have had dental surgery, the temporomandibular joint kind of surgery, horrible things, and the pain continues, and it's only when you suppress that for several years, they get back to normal life. So that's the clinical part. So are there biological data that support herpes as a factor for ME/CFS exacerbations? The herpes infections stays latent for life. We already stated that. And you don't have to be immunocompromised in the traditional sense to reactivate it. So we do see that in the overtly immunocompromised patients, in the patients that I see with solid organ transplants, bone marrow transplants, cancer, who have all that overt hit in the immune system. They do reactivate these things, and they die, in fact, if you don't act promptly. But also, it is well known that herpes can reactivate without that obvious compromise of the immune system. The other thing is the natural killer cell story in ME/CFS, and our group hopes to contribute a piece for NK cell story in the next few months. But it's well known that NK cells appears to be a key cell that is compromised, and Nancy showed that yesterday. And NKs have been primarily evolved in our immune system to take care of tumors and viruses, and particularly herpes viruses. The other story is Nancy's group about the deoxyuridine triphosphate nucleotide hydrolases, or DUTPases, are higher. Antibodies against this enzyme are higher in ME/CFS patients and Gulf War illness, suggesting that there is more activity of the herpes. And herpes has been associated with severity, like our group established. And we have a small sample randomized double-blind placebo-controlled clinical trial showing that valganciclovir appears to bring an improvement in the symptoms and in the cognitive function of these patients. So herpes simplex can also reactivate in the genital areas of normal people, non-CFS, even they are asymptomatic. We have found a subgroup of patients at Stanford that have the herpes on the buttock area, genital, and that group seems to be with worse symptoms. This is usually postmenopausal women. Herpes can reactivate in the nasal and oral mucosa of healthy adults, even the lesions are not present. And the beautiful, fascinating Mollaret's meningitis, where it can go even to the spinal fluid. So it's basically taking fuel from the fire, what the herpes will do. And I just want to say, remember Dr. Lerner, who was a major proponent of antiviral therapies. And like Maurice Béjart, before he died, says, hope is always victory. Thank you.